Dialogue with a Doctor, featuring one of Southwest Florida's leading gastroenterologists, Dr. Raymond Phillips of Gastroenterology Group of Naples.
Welcome to our show today. We have Dr. Raymond Phillips with us, and he's one of the leading doctors here in Southwest Florida. And Dr. Phillips, tell us a little bit about yourself.
Well, thanks for asking me back once more, Jim. I appreciate it. I'm a gastroenterologist, and that means I'm a specialist in digestive diseases. Digestive diseases such as ulcers or reflux and colitis, Crohn's disease. But a gastroenterologist is very, very specialized. You know, we've had a number of years of training. You know, I went to college, Princeton University, went to medical school at Washington University in St. Louis. And then after I completed my training in medical school and graduated, I went on active duty in the Army because of an ROTC scholarship, and I was paying back my obligation, and I was an internist for 2 years. But before that, I did a 4-year residency in internal medicine at Jefferson Hospital, then came on active duty for 2 years, and then was selected for gastroenterology training at Walter Reed, where I was trained as a gastroenterologist for 2 years, and then I was selected to be on staff and where I did research and supervised other gastroenterologists. So the point being is, as a gastroenterologist is a very, very specialized area of internal medicine, and we're experts in these digestive illnesses that I gave you some examples of, but also other areas such as liver disease, pancreatic disease, et cetera. So we have a broad range of exposure to a lot of different conditions, and but we're also active in terms of maintaining your health, and such as issues such as screening colonoscopy, or screening for colon cancer, and we were chatting about that earlier. So
how do we go about that, and how do we pick a doctor like you?
Okay, well, that's a real good question. Yeah, that's the you know, for a gastroenterologist, particularly for someone who's healthy,
right,
who doesn't really like to think about doctors, selecting a gastroenterologist can be a little bit of a challenge. And in the context of prevention of colon cancer and screening for colon cancer, the metric that we use, you know, the ruler, if you will, that we use in terms of judging a gastroenterologist is their ability and their effectiveness at doing a screening colonoscopy.
Right.
And just to briefly review for you, a colonoscopy is a flexible endoscopic examination where we look in the entire extent of the colon, and we typically will do that while individuals sedated. And the purpose of it is typically when someone becomes an adult, when they're 50 or more, we'll do that as a means of identifying polyps within the colon with the intent of removing the polyps so they won't have an opportunity to mature into something more serious, such as a colon cancer. And it's that age group between 50 and 65 where colon polyp formation becomes more common. And in previous studies, we've demonstrated very clearly that by identifying polyps and removing them, we can prevent them from maturing into a cancer. Now, like a lot of things in life, some people are better at that than others, you know, and better at doing the examination, more effective at doing the examination, but in particular, better at identifying polyps. And the metric that we use is one that's called an adenoma detection rate. And it basically means how good are you at finding, how good is your gastroenterologist at finding polyps? And to give you a perspective, if I took 1,000 healthy individuals who are aged 50 to 60, if they're all male, and now of those 1,000 individuals, 250 of them, around that, would have polyps. And so if you did an examination, a colonoscopy, that was 100% effective in that group of 1,000 people, you would find 250 individuals with polyps. You would have an adenoma detection rate of 25%, which is our benchmark at saying that, hey, you're an effective gastroenterologist for screening purposes. If someone says, hey, my detection rate is 5%, oh, they're missing a lot of polyps. And they may be a nice person, or they may be congenial in other ways, but they're not very effective as far as finding polyps. And that's an item of concern when you're doing an examination like a colonoscopy, because when we do an effective examination, we feel very confident that we can wait 10 years before doing the next examination. If someone's not very good at finding polyps, then there's a risk that many polyps may be undetected and then mature into something more serious between examinations. So that's why, now we encourage individuals who are considering a gastroenterologist to really ask their gastroenterologist, what is your adenoma detection rate? Formerly, we used to say, well, gee, are you safe at doing that? And that's important. That's very important in terms of minimizing risk. The other metric that we had gone by is, well, gee, are you careful at doing the examination? Are you spending enough time? And that's important too. But really, our best measure of how effective you are is what I've just been dwelling on. Again, it's called the adenoma detection rate. Now, I've been talking about screening colonoscopy as a tool to screen for colon cancer. I don't mean to suggest that's the only way to do that enterprise. And what I mean by that is some individuals are not enthusiastic about having a colonoscopy done.
Right.
And they would prefer less invasive means of being able to achieve that goal. And years past, one of the means that we had was to detect microscopic blood in your stool. That is to say, if there was an evolving polyp growing into a cancer, it might release or shed some blood. That was, and it typically would be microscopic in its volume, but it could nonetheless be detected by doing testing of occult blood in the stool. And that was available for years and years, and it still is available in the context of a physical examination. A newer intervention in this last several years has been a test called a Cologuard test, where it's a DNA-based test that detects abnormal DNA in the stool that might be arising from a developing colon cancer. Kind of interesting here from a scientific standpoint is that colon cancers that are developing within the colon before they're causing any symptoms, sometimes those colon cancer cells will die and they'll be cast off in the GI tract in the stool. The DNA within those cells is very durable, and it's abnormal compared to the normal DNA of the normal colon. And it's possible now, by taking a sample of a stool, you can actually detect that abnormal DNA and be able to get a pretty good indication whether there may be a developing colon cancer within that individual. So that test simply requires submitting a stool sample for analysis. And if it's normal, then you wouldn't need to have it done again for 3 years' time. If it's abnormal, then you'd go ahead and do a more involved examination like a colonoscopy to really pin down where, if anywhere, there is a colon cancer within the colon itself. So it provides a useful alternative for a non-invasive approach for those individuals who are not either are not enthusiastic about it,
right,
or just for whatever physical reason they don't feel like they want to undergo a colonoscopy.
So if somebody has some polyps, you recommend every 5 years afterwards, don't you?
That's correct. If an individual, say, has a colonoscopy,
right,
and polyps are detected and removed, it's clear they have a tendency to form them. The formation process is relatively slow, so we don't need to come back necessarily every year, but a 5-year interval would seem to be appropriate and has been shown to be effective as far as preventing colon cancer. Now, there's always caveats to that. For example, if someone has many polyps, or if they have particularly large polyps, then we may want to come back at a shorter time frame than 5 years. If there is a familial tendency, that is to say an inherited tendency to form polyps, those individuals, we typically will come back at a shorter interval either a year or two, and often we'll start the screening process much earlier than the age of 50. And perhaps at the age, oftentimes in their 20s or 30s. But that very much depends on the family history and the family experience.
Dr. Phillips, thanks for coming on the show today, and we've learned a lot, and thank you for coming back on again in the future, okay?
All right, thanks so much, Jim. I always enjoy it.
Thank you.
Are you in need of a gastroenterologist in the Naples, Marco Island, or Bonita Springs area? Dr. Raymond Phillips of Gastroenterology Group of Naples, along with his fellow physician associates, are board certified in gastroenterology hepatology and one of the most respected medical practices in Southwest Florida. Hear it from one of his patients directly.
I've been a patient of Dr. Phillips for myself personally the last 20-25 years. He's treated my family, my extended family, my friends. I never mind coming here because it's a very friendly place, and everyone here makes me feel that way. They're so caring. And Dr. Phillips, I get a chuckle out of him because everywhere in his building it says, "We work where the sun don't shine."
With the medical industry changing so rapidly, Dr. Raymond Phillips offers the newest technology and treatments in his field. If you are looking for a practice that is attentive and will address all your questions and concerns, call Dr. Phillips' Naples office today for an appointment at 239-649-1186.